Hello everyone, this video is about AIDS, acquired immunodeficiency syndrome or HIV infection. Globally, AIDS caused an estimated 3.1 million deaths in 2003, 2.5 to 3.5 million. The epidemic has continued growing with estimates of 5 million new infections and 2.5 million children living with AIDS or HIV. Emergence was in 1981 of a cluster of diseases associated with loss of cellular immunity in adults who had no obvious reason for presenting such immune deficiencies. Within several weeks to several months after infection with HIV, many persons develop an acute self-limited mononucleosis, like illness lasting for a week or two. They may then be free of clinical signs or symptoms for months or years before other clinical manifestations develop. AIDS associated disease categories: gastrointestinal cause most of illness and death of late AIDS symptoms: diarrhea, wasting, extreme weight loss, abdominal pain, infections of the mouth and esophagus, pathogens: Candida albicans, cytomegalovirus, microsporidia, and cryptosporidia. When AIDS associated disease categories: respiratory, 70% of AIDS patients develop serious respiratory problems. A partial list of respiratory problems associated with AIDS: bronchitis, pneumonia, tuberculosis, lung cancer, sinusitis, pneumonitis. And AIDS associated disease categories: wait a minute, bronchitis, pneumonia, tuberculosis, lung cancer, sinusitis, pneumonitis. And AIDS associated disease categories: neurological, epigenetic diseases and tumors of central nervous system. Symptoms may include headache, peripheral nerve problems and AIDS, dementia complex, memory loss, motor problems, difficulty concentration, and paralysis. AIDS associated disease categories: skin disorders, 90% of AIDS patients develop skin or mucous membrane disorders. AIDS associated disease categories: skin disorders, 90% of AIDS patients develop skin or mucous membrane disorders. Kaposi sarcoma, 1/3 male AIDS patients develop case. Kaposi sarcoma, most common type of cancer in AIDS patients. Herpes zoster, then herpes simplex, Zurich, invasive cervical carcinoma, eye infections. 50 to 75% patients develop eye conditions. CMV, retinitis, conjunctivitis, dry eye syndrome, extensive tumor lesions of Kaposi sarcoma in AIDS patients. And I need to change this because some viewers might find it kind of disturbing. An infectious agent: human immunodeficiency virus, HIV, retrovirus, two serologically and geographically distinct types with similar epidemiological characteristics. HIV-1 and HIV-2 have been identified. The pathogenicity of HIV-2 may be lower than that of HIV-1. Lower rates of mother to child transmission for HIV-2. So the pathogenicity of HIV-2 may be lower than that of HIV-1. Structure of the human immunodeficiency virus HIV is a retrovirus. Envelope, glycoprotein, protein coat, RNA, two identical strands. Envelope, glycoprotein, protein coat, RNA, two identical strands. Reverse transcriptase. Wait a minute, once again. Reverse transcriptase, RNA, two identical strands. Protein coat, glycoprotein, and envelope. Occurrence: AIDS was first recognized as a distinct clinical entity in 1981. However, isolated cases appear to have occurred during the 1970s and even earlier in several areas: Africa, Europe, Haiti, USA. Of the estimated 40 billion persons living with HIV infection or AIDS worldwide in 2003, the largest elements were estimated at 2005 to 28.2 million in sub-Saharan Africa, 4.6 to 8.2 million in South and Southeastern Asia, 13 to 1.9 million in Latin America, North America. People living with AIDS by the end of 2001. HIV-1 is the most prevalent HIV type throughout this world. HIV-2 has been found in Africa. Humans reservoir: HIV is thought to have recently evolved from chimpanzee virus. Mode of transmission: person to person transmission through Transmission through unprotected heterosexual or homosexual intercourse, contact of braided skin or mucosa with body secretions such as blood, CSF, or semen. The use of HIV-contaminated needles and syringes, including sharing by intravenous drug users, transfusion of infected blood or its components. Mode of transmission: transplantation of HIV-infected tissues or organs. The presence of a transplantation of HIV-infected tissues or organs. That cause is not that much familiar, but still that exists. Okay. The presence of a concurrent sexually transmitted disease, especially an ulcerative one, can facilitate HIV transmission. Unprotected intercourse, no condom, unprotected sex with many recurrent or overlapping sexual partners. Then HIV can be transmitted from mother to child or vertical transmission. From 50% to 35% of infants born to HIV positive mothers are infected through placental processes at birth. HIV infected women can transmit infection to their infants through breastfeeding, and this can account for up to half of mom to child HIV transmission. Giving pregnant women antiretrovirals such as zidovudine results in a marked reduction for MTCT or vertical transmission. After direct exposure to healthcare workers to HIV-infected blood through injury with needles and other sharp objects, the rate of seroconversion is less than 0.5%, much lower than the risk of hepatitis B virus infection after similar exposure, about 25%. Unsafe injections may account for up to 5% of transmission. While the virus has occasionally been found in saliva, tears, urine, and bronchial secretions, transmissions after contact with these secretions has not yet been reported. Mode of transmission: when the virus has occasionally been found in saliva, tears, urine, and bronchial secretions, transmission after contact with these secretions has not yet been reported. No laboratory epidemiological evidence suggests that biting insects have transmitted HIV infection. HIV transmission in the United States and rest of the world. Oh my. To a great extent, that's homosexual relationships. Yeah. Drugs against HIV. Reverse transcriptase inhibitors. Competitive enzyme inhibitors, example AZT, DDI, DDC. Protease inhibitors. Inhibit the viral proteases, prevent viral maturation. And I would like to clarify something. This data is previous one, not present one, and I don't know whether this data has any relevance now, so I won't be judging anyone. Okay. Drugs against HIV. Reverse transcriptase inhibitors. Competitive enzyme inhibitors, example reverse transcriptase inhibitors. Competitive enzyme inhibitors, example AZT, DDI, TC. Wait a minute, I am going to change the overview. Reverse transcriptase inhibitors, competitive enzyme inhibitors, protease inhibitors. Reverse transcriptase inhibitors inhibit the reverse transcriptase inhibitors, competitive enzyme inhibitors. Then protease inhibitors inhibit the viral protease, prevent viral maturation. Problem with individual drug treatment. Then resistance. Drug combinations and a combination of one or two reverse transcriptase inhibitors, one or two protease inhibitors. Drug cocktails have been very effective in repressing HIV replication and prolonging the life of HIV infected individual, but long-term effectiveness is not clear. Incubation period variable, long, although the time from infection to the development of detectable antibiotics is generally 1 to 3 months. The time from HIV infection to diagnosis of AIDS has an observed range of less than 1 year to 15 years or longer. The median incubation period in infected individuals is shorter than in adults. Then period of communicability, not known precisely, begins early after onset of HIV infection and presumably extends throughout life. Infectivity using the first months is considered to be high. Infectivity. It increases with viral load, with worsening clinical status, and with the presence of other STDs. Susceptibility. The presence of other STDs, especially if ulcerative, increases susceptibility, as may the fact of not being circumcised for males, a factor possibly related to the general level of female hygiene. and interactions between HIV and other infectious disease agents. Mycobacterium tuberculosis infection. Persons with latent tuberculosis infection who are also infected with HIV develop clinical tuberculosis at an increased rate with a lifetime risk of developing tuberculosis that is multiplied by a factor of 6 to 8. This interaction has resulted in a parallel pandemic of tuberculosis. In some urban sub-Saharan African populations, wherein 10% to 50% of adult population have a dual infection, Mycobacterium tuberculosis and HIV. Other adverse interactions with HIV infection include pneumococcal infection, non-typhi salmonellosis, also paramalaria, and visceral leishmaniasis. Methods of control, preventative measures, HIV/AIDS prevention programs can be effective only but full community and political commitment to change and or reduce high HIV risk behaviors. Public and school health education must stress that having multiple and especially concurrent or overlapping sexual partners or sharing drug paraphernalia both increase the risk of HIV infection. Methods of control, the only absolutely sure way to avoid infection through sex is to abstain from sexual intercourse or to engage in mutually monogamous sexual intercourse only with someone known. In other situations, latex condoms must be used correctly every time a person has sexual intercourse. The methods of control, expansion of facilities for treating drug users reduce HIV transmission. HIV testing and counseling is an important intervention for raising awareness of HIV status, promoting behavioral changes, and diagnosing HIV infection. HIV testing and counseling can be undertaken for persons who are ill or involved in high-risk behaviors at centers at antenatal clinics or diagnostic maternal infection and prevent vertical transmission. Couple counseling, marital or premarital, then anonymous and confidential HIV counseling and testing for the worried well. Methods of control, all pregnant women must be counseled before HIV early in pregnancy and encouraged to undertake an HIV test as a routine part of standard antenatal care. Those found to be HIV positive take a course of ARV treatment to reduce the risk of their infant being infected. Methods of control, all donated units of blood must be tested for HIV antibody. Only donation testing negative can be used. People who have engaged in behaviors that place them at increased risk of HIV infection should not donate plasma, blood, organs for transplantation, tissue or cells including semen for artificial insemination. Only clotting factor products that have been screened and treated to inactivate HIV must be used. Care must be taken in handling, using and disposing of needles or other sharp instruments. Healthcare workers should wear latex gloves, eye protection, and other personal protective equipment in order to avoid contamination with blood or with fluids. WHO recommends immunization of asymptomatic HIV-infected children with the EPI vaccines. Those who are symptomatic should not receive BCG vaccine. Live measles, mumps, rubella, and polio vaccines are recommended for all HIV-infected children. Report local health authority. Official reporting of AIDS cases is obligatory in most countries. Official reporting to HIV infections is required in some areas. Class 2 isolation. Isolation of HIV positive person is unnecessary, ineffective, and unjustified. Universal precautions apply to all hospitalized patients. Then concurrent disinfection of equipment contaminated with blood or body fluids with secretions and secretions visibly contaminated with blood and body fluids by using bleach solution or germicides. Quarantine not applicable. Immunization of contacts not applicable. Then notification of contacts and source of infection. The infected patient should ensure notification of sexual and needle sharing partners whenever possible. And management, it must be managed as a chronic disease. Antiretroviral treatment is complex, involving a combination of drugs. Resistance will rapidly appear if a single drug is used. The drugs are toxic and treatment must be lifelong. In addition, treatment of other additional associated conditions will be needed. Then epidemic measures. HIV is currently pandemic with a large number of infections reported in Africa and America, Southeast Asia and Europe. Disaster implications. Emergency personnel should follow the same universal precautions as health workers. International measures. The United Nations Joint Program on HIV/AIDS and AIDS, which coordinate UN activities, and WHO, who do not introduce measures such as requirements for AIDS or HIV examinations for foreign travelers prior to entry.